Have you been dealing with sacroiliac joint pain, or possibly front of your hip pain, or a little bit of both? Hi, welcome back to my channel. This is Running in Rehab. My name is Brett. Today's going to be a video for anybody who's experiencing sacroiliac joint pain. Sacroiliac joint is where the sacrum meets the ilium of your pelvis, and you can kind of feel the big bump in your back, lower back, and that's a part of your pelvis. That's your PSIS, and that's where the sacrum meets the pelvis. Okay, that's your sacroiliac joint. If you have any pain there, and sometimes it refers in towards the sacrum, you may be dealing with sacroiliac joint pain. For me, I was dealing with that same kind of pain on my right side, and I was having pain in the front of my hip on the right side. And that's because if you have a little bit of instability on the right, the pelvis can actually dump forward a little bit and impinge upon your right hip, or whichever side the pelvis is kind of going forward on and unstable. You can kind of get some hip or labral discomfort in the front of your hip, and it feels like a little bit of impingement. Now, how can you check your pelvic alignment? This can be done when you're lying on your back or by a medical professional, but if you want to check for yourself, and if you're having these sorts of symptoms, you can check your ASIS, which are the big bumps on the front of your pelvis, right? So if you go to your crest, your iliac crest, follow it down, you'll feel big dimple type, big bony prominences. And if one side is lower, and that if it's lower, that could indicate that you're rotated a little bit forward if that side is lower than the other side. Now, if you've been told by a medical professional that one side is rotated forward, there's a reason for that. There's something that's weak in your body that we're going to address today. I'm going to give you how to diagnose which muscle group is weak and how to strengthen it for more stability on that side and less pain. So let's get right into it. We'll use my case example. The right side of my pelvis was rotated forward or anteriorly. It was because there are three muscle groups that you want to take a look at that can be allowing your pelvis to rotate forward. Your right obliques, right, your right-sided core muscles are your obliques on the right. If they're weak and lengthened, that can allow for the pelvis to dip forward, right? So this is the right side of my pelvis. It can dip forward because my obliques aren't strong and holding them upright and holding my pelvis upright. If my obliques are weak, it just allows the pelvis to dump forward. So I hope that makes sense for you. Take a look at your right-sided core muscles. Are they weaker than the left? Do you feel them? Are you able to engage them? Take a look at your core muscles because they keep the pelvis in a neutral position and won't allow your pelvis to rotate forward on that side. Also take a look at your right hip abductors. So your glute medius is the muscle on the side, and that muscle group swings your leg out away from the midline. Abductors. Swing your leg out away from the midline. Strengthen that glute medius, and strengthen your glute max, your hip extensor. So here's my pelvis, here's my glute max. If my glute max is weak and lengthened, again, my pelvis can fall forward. If my glute max, I strengthen it, it can bring my pelvis back into a neutral alignment. Okay? So again, test this out on both sides. If you feel that your right glute max maybe isn't firing as much as your left side, that's an indication that your right glute max may be weak relative to the left side. This can be that imbalance that's allowing your pelvis to dump forward. So, to cover all your bases, strengthen your obliques. If you have a right rotated pelvis, strengthen your right obliques, strengthen your right abductors, and strengthen your right glute max. That will cover all of your bases, and that should fix your problem. If you have any discomfort and pain gets worse, stop what you're doing and go see a medical professional. But all of the strengthening of these muscle groups should feel good for you and should take care of your problem. Secondarily, your hip flexors may be tight on the right, so you can stretch those out a little bit too, just to help even things out a little bit. Over time, the hip flexors can become overworked because they're trying to stabilize and they're just pulling. The obliques aren't doing their job, so they can become overly tight. But that's a secondary issue. Focus on the strength of those three muscle groups that I just gave you, and that should take care of your problem. If you're having a left-sided issue and you want me to explain that, or if a medical professional told you that you're posteriorly rotated, I can go through how you can self-treat that as well. But again, let pain be your guide. If pain is increasing with any of the activities, with any of the strengthening of the muscle groups that I gave you, stop and go see a medical professional. But for the majority of you, this should help your pain and fix the root cause without a medical professional manipulating your pelvis and putting you back into your bony alignment, back into alignment. From what I've seen, that's just short-term fix. If you want a long-term fix, address the root cause. And in this video, I hope that I covered that for you. If you've made it this far, thank you for watching. I hope this video helps. Like, comment, subscribe, and I hope to see you on the next one.